My name is Max, and to my persona, I'm 20 years old and live in Germany. I also make my apprenticeship here, and I want to show you why the MTRA profession is so underrated and why this profession is actually very cool. So enjoy the video. So before we start, you need to know that MTRA means medical, technological, radiological and assistant. So what is an MTRA employee? Basically the interface between the doctor, the patient and the engine. He has a big responsibility on his shoulders. He guarantees the safety for himself, for the patient and for the whole medical staff in the hospital. Dealing with high-tech devices, including IT imaging, and the management of the patient is part of everyday work and requires technical skills and understanding. As the first contact of the patient, an MTRA should have some empathy, patience, and a friendly demeanor. In order to be able to withstand critical emergency situations, an MTRA should have a physically and mentally resilient. In addition to the already mentioned characteristics, you should have some enjoyment to work with people, especially with sick people, and you do it in a team. So you should be a team player and take responsibility because you have big responsibility on your shoulders. So have some flexibility in your planning and care for your job, for your profession. After 3 years and a successful final exam, you have to choose between 3 disciplines: radiological diagnosis, radiotherapy and nuclear medicine. Quick review! Broke your arm, intestine hurts, we need to look closer. Well, then we use the CT, computer tomography, the MRI, magnetic resonance imaging, or the conventional X-ray. So we have here the case of the UNO reserve card. So instead that we sense electromagnetic waves to the patient to have an image of his bones, we actually bring the patient to send us the electromagnetic waves. We do it in that way that we give the patient the radiopharmaca. It's very oversimplified how I explain it, but with that method we have the chance to know how the organ that we investigate are working. Tumor, cancer, metastasis, carcinoma sounds horrible. It is. Only a few patients receive radiation therapy for benign disease. The therapy takes place both through the skin and through the use of radioactive preparation in the cavities as well as interoperable. The fourth point is dosimetry and radiation protection. In this specialty, there is hardly any contact with patients. Rather, you ensure safety in terms of radiation protection in the background. MTRAs takes over the treatment planning, carry out quality controls and check the therapy devices. So is it dangerous? Actually no, because if we make an examination on a patient, then we go mostly out of the examination room and stand behind radiation protected walls. Due to strict requirements that we have combined with well-founded training that we learn in apprenticeship, is no radiation risk expected. So, and where are we working? Mostly in the medical sector, like hospitals, medical practices, or in research institutes, also in the industry sector. I hope I could give you some quick guide what an MTRA is and what he or she is actually doing, and I hope you enjoy it, and I see you next time.